How does your community respond?
Thank you for walking me home. I'm not feeling good at all.
Sexual violence is a major public health problem in every state. It happens more frequently than is reported or talked about and is often committed by someone the victim knows. Victims and their families can suffer for many years. Facilities can reduce the initial trauma as well as future re-victimization by having trained medical, social work, and mental health providers addressing the survivor's immediate and follow-up needs. According to the Rape, Abuse, and Incest National Network, or RAINN, every 109 seconds an American is sexually assaulted, and every 8 minutes that victim is a child. Meanwhile, only 6 out of every 1,000 perpetrators will end up in prison.
So a sexual assault survivor has just been through what may be, quite possibly, is the most horrific experience of her life. She may be in shock, she may be quiet, she may be, or he, I should say he as well, may be in acute distress. We just don't really know, but what we do know is they've been through something horrible. So the first people they encounter are crucial to that person's well-being. It's crucial to that person's well-being because it can really set the stage for what comes next in that person's emotional response.
We currently don't live in a country where survivors are respected and honored and not blamed for their victimization, and so coming forward is insurmountable. And every time a sexual assault happens in the media and nothing happens and we can see that there's no accountability, then we have more survivors calling the hotline who don't come forward. And so unfortunately, it's a vicious cycle because sexual assault has long-term health implications. And so those health outcomes could be mitigated if we start at the very beginning with a victim-centered approach where the victim feels like they can actually disclose their assault.
How could your community respond? The thousands of men and women who are sexually assaulted each year deserve the same quality of care that is provided to other patients seeking care in an emergency department. Victims of sexual assault also deserve justice. First responders and health professionals must know how to work effectively with law enforcement and the legal system to seek justice. Successful prosecutions help prevent future assaults. In the state of North Carolina, the vast majority of professionals trained to perform sexual assault examinations are registered nurses. Sexual assault nurse examiners, known as SANEs, are the most qualified health professionals to provide physical and emotional care to the patient and to properly collect valuable forensic evidence for the criminal justice system.
So sexual assault nurse examiners really came about. The early historical perspective is probably in the 70s when some nurses across the country recognized that patients presenting to emergency departments in particular were not getting very good care when it came to sexual assault issues. What we know about sexual assault is that, one, most patients actually aren't going to seek care, aren't going to report, and when they do present to particularly the emergency department, they're not going to be people who actually were trained to take care of them in the way that their issues presented.
In the past, patients have been seen, and currently in facilities that don't have SANE trained nurses, a patient's going to be seen by an emergency room physician. They're going to see that the ER staff are busy, that they're not seen necessarily as a priority and a patient that has a life-threatening emergency. And that really does affect the patient's overall psychological trauma that they experience in the emergency room. And some patients have described that as being re-raped.
They had been victimized, home invasion, and she was only seeking care for her child who had been thrown against the wall. But she had been sexually assaulted by 3 of the intruders in that home invasion. And so she allowed us to take care of her. She allowed us to do an evidence collection kit, and that was able to give her a better long-term outcome. We were able to connect her with resources outside of the hospital, outside of the emergency setting in the community, so that she had follow-up care and was able to get the counseling that she needed.
I think I've seen an incredible increase in the last 10 years in the need and necessity for the medical system, particularly nurses and doctors, aiding us in the prosecution of both domestic violence and sexual assault cases. With the introduction of SANE nurses, we have been tremendously successful in prosecuting very difficult, intimate cases. And they want as much evidence as possible, and a lot of that evidence is collected at the hospital. I have been used to getting these SANE nurses with our victims immediately so they can do a forensic interview where it's not just a what happened, what do you remember. It is asking pinpoint questions because many of these people are traumatized. They don't know what the system needs. So you need these people while they're collecting evidence, collecting the rape kit and taking blood. They also can be there to collect any type of information from these victims that will help us follow up an investigation and help present it to the jury. It's amazing how if we don't have that at our disposal and we get to the victim, I don't know, 2 weeks to 2 months later, and we find out there's information we've missed, juries don't like it when there's a delay in reporting. It seems almost as if a victim's dishonest, and oftentimes it has nothing to do with that at all. But the quicker we can get all of that information from the victim onto a piece of paper recorded and follow up is just a tremendous asset to us in prosecuting these cases.
So a lot of research has been conducted on the outcomes of the psychological effect of patients if they've been seen by a SANE, and they're really seeing a pretty dramatic increase in the positive outcome that patients have long-term from seeing a SANE. The other impacts, a SANE is going to be specifically trained on injury identification, on disease process, on evidence collection and chain of custody, and just kind of a better overall medical forensic exam, and ultimately help our patients get justice for their assaults.
This should never have happened to you. How can I support you in this? How can I develop that trust and that continued relationship with the individual who's been traumatized? I think that's another piece in the SANE training also, is how critical it is to begin that relationship from a place of safety and trust, which allows a victim to have their voice and to share their experience with you. For myself, coming at it from an angle of survivor who made the choice and the decision not to seek help for all those reasons, fear of not being heard, fear that my story would not add up to those that were hearing my story. And when I have the opportunity to go into the hospitals and work with the SANE trained nurses, it reminds me that now it's different somewhat, and that there are individuals at the hospitals who are trained and do understand the trauma of rape. So that gives me some comfort.
Jurors, judges, the whole court system is just really relying on evidence. Evidence, you know, we know in sexual assault cases, for example, the rapist doesn't often ejaculate, just to be blunt. That often doesn't happen. And yet the courts, law enforcement, legislators in Raleigh, they want to see that. So having, again, as I say, a nurse that believes them and supports them, but that also really knows how to conduct the exam, to collect evidence and not miss anything, is going to be important to that court case.
Communities with SANE programs embedded in local hospitals, in coordination with a multidisciplinary team of community resources, provide a best practice model for managing treatment, recovery, prosecution, and prevention of sexual assault. Indeed, there are challenges to having a prepared community with a sufficient sane workforce, and thus an integrated response for sexual assaults.
More and more what we have found is that people just really are not wanting in the emergency departments to provide care because, and seems to be the primary reason is we don't have anyone here trained to provide this level of care. So they're transferring them. The fact of the matter is that many people, unfortunately across the state now and communities, are having to travel outside their communities. What this means is travel for families, expense, particularly if they're sent by ambulance. Some of them are being sent 2-3 hours away from their home community.
I'm already maybe feeling shame. I'm most probably in pain, but I'm still reaching out and I'm still sharing what has just happened to me. And then I'm told, we're sorry, we don't have a nurse here that can assist you right now. We're going to have to refer you out to another hospital. So I'm going to have to go and tell my story again. That's re-trauma.
SANE programs are great, but there is a challenge even for communities such as Chapel Hill and a hospital like UNC Hospitals to be able to sustain those types of programs because they're labor intensive, high energy, high commitment on the behalf of the SANE examiners, and that creates some issues with the long-term success of a program.
Yet every community has a unique set of resources and partnerships that can be mobilized to shape its response. Challenges can be overcome.
So we have seen in just the first year of working collaboratively with our multidisciplinary team, we actually saw our numbers triple the amount of patients that presented to our emergency department. And I do not believe that there has been an increase in the actual sexual assault taking place. I think it has been more an awareness to, one, our law enforcement to know when they can recommend that a patient come to the ER to have a kit collected. We've done community outreach so that people know just in the communities what resources are available at the hospital and how we can help them. And then we've had a really great working relationship with our advocacy group who also answers the phone calls when people do call the anonymous rape hotlines, and they will recommend that people come to the hospital. So I think it hasn't been just one thing, but just working collaboratively with all our different disciplines and out in the community has really shown that we can improve the medical care and have people come to the hospital for treatment. There's also a consensus.
Hospitals play a key role in the problem of sexual assault, both in helping build and sustain a prepared community of resources, but also in what they do best, patient care. Hospitals are vital to providing a victim-centered approach. The Office for Victims of Crime recommends that the victim's wishes, safety, and well-being take priority in all matters and procedures. How can our communities respond now? Recognize that sexual assault takes place in your community. Don't ignore it. Talk about it. Keep the conversation going with the community, with health providers, police, assistant district attorneys, rape crisis centers, and members of sexual assault response teams. Support the education, retention, and sustainability of forensic examiners like SANES in your local and regional communities. Assure that every victim has access to appropriate medical and mental health care, and that the collection of pertinent evidence is handled in a forensically sound manner and passed on to law enforcement with the appropriate chain of custody maintained. Successful prosecutions are a key component of prevention.
The first effort is to make people aware that it's a problem. The second step is to probably put a guiding coalition in place. The third aspect, particularly as it relates to this problem, is how do you make people recognize the underreporting. We still as a society excuse some of these situations. Recent news stories point to that fact. So how do we really address it from the standpoint of let's make sure everybody that has had any form of unwanted sexual type assault or advance, that they're coming forth.
Don't forget about our sexual assault victims. They are your family, they are your friends, they are your patients, but they are scared and frightened and don't know where to turn. And if you turn to a hospital to help you with those needs and they're not there adequately trained, I mean, what does that say about your community?
Like many other things that we've dealt with, from injury prevention to cardiac care to stroke care, everything, it's when everybody gets around the table and says enough that we're able to get traction and really fundamentally do something different.
Sexual assault. Enough is enough. We know what works. A fully trained and staffed SANE workforce working within a collaborative community is vital to excellent patient care and recovery, to criminal prosecution of perpetrators, and ultimately to the prevention of this serious problem. How will your community respond to help stop the violence?